Hello students, welcome to Module 2. We're going to be discussing the nursing roles and responsibilities in relation to infusion therapy. So some of the aspects of the nursing role that we're going to take a look at is role delineation, scope of practice, collaboration, infusion nursing teams, mentors, educator and knowledge share, barriers, innovator, researcher, leadership, resource nurse, and shared governance. So whether you realize it or not, as a member of the nursing workforce in general, and especially in relation to infusion therapy, you will at some point fulfill one of these roles in your career. So we'll take a look at those in a little bit more detail as we go. Some of the things that we want to consider when we specifically look at IV departments as a whole. There are three areas that we need to be familiar with. Of course, as an infusion nurse, we look at policies and procedures. We also look at qualifications of the IV nurse, and this includes basic IV administration capabilities as well as specific qualifications for those nurses who are certified in infusion therapy. And then we also look at the core areas of the theoretical curriculum that are behind the infusion therapy and the infusion certification. So when we think about policies and procedures, of course, we know that these guide operations, whether you're a registered nurse, staff nurse, or whether you're an infusion therapy certified nurse, policies and procedures are going to guide what we're able to do in practice. They provide the nurse with adequate instruction anytime within any area of the nursing field, no matter what you're doing, IV therapy, medication administration, procedures. You need policies and procedures that really provide you instruction on how you are to complete certain tasks, especially in relation to how the facility, because facilities can vary in their policies and procedures, the way they want things done. And if you ever have to go to a court of law, your policies and procedures are going to be what provides evidence that you have performed as a competent nurse. Policies and procedures also help to benefit patient care. Without policies and procedures, patient care can dwindle, and patient outcomes can really be affected in a negative manner. So when we have policies and procedures, no matter what we're talking about, whether it be IV therapy or Foley insertion, they ensure that our patients receive the highest level of care possible and that their outcomes will be impacted in a positive manner. They also provide legal protection, which I mentioned a while ago, and policies and procedures, when developed by healthcare institutions, healthcare facilities, they typically look at state and federal laws and they abide to or are developed to abide as closely to those laws as possible. And again, they describe the nurse's responsibilities, no matter what the policy and procedure relates to, whether it be infusion therapy, Foley insertion, medication administration. It's always going to provide a very good description of what the nurse's responsibilities are in that manner. So when we think about IV certified nurse, or even just basic, a staff nurse that's going to administer something IV that may not be actually certified as a infusion therapy nurse, we have to think about specialized judgment and skills. And part of this is where the LPN and the RN role vary. Because as you know, in your LPN curriculum, there were very limited times when an LPN could actually utilize or infuse via, the intravenous route. The RN's scope of practice is a little bit different. So that's one of the things that we need to take into consideration, because an RN scope of practice is much broader. For instance, allowing the RN to administer blood and blood products. An LPN is not covered to do that in her scope of practice, but an RN is. And sometimes this even goes back to policies and procedures, because sometimes, individual facilities' policies and procedures are different as far as even your scope of practice. If you are interested in pursuing a certificate or a certification in infusion therapy, you would have to go through an accredited program of study, meaning there are certain programs that offer the infusion therapy course and the content that is required to allow you to become an infusion certified nurse. and then that, of course, leads to credentialing. So some of the qualifications, characteristics that a nurse needs to have who's going to be involved in infusion therapy, whether it's just basic infusion or certification, you need to be meticulous. There are a lot of steps involved with the administration of IV medications, IV fluids, blood, chemotherapeutic agents. So you have to be meticulous and very organized in your approach to delivering these types of treatments. You have to be accountable, conscientious. Again, you need to be paying attention to what you're doing. You need to be dedicated, mentally and emotionally stable. Of course, this should be really with every area of the nursing field. Manual dexterity, of course, we're going to be really utilizing our hands as we prepare IV solutions, IV tubing, setting pumps, that kind of thing. And then, of course, we also want to have outstanding verbal and written communication skills, because just like with anything else that we do as nurses, we have to be able to verbalize what we've done and also to document, because documentation is what, number one, communicates what you have done during your shift to the next nurse for that coordination of care and continuity of care, but it also helps to protect you in those instances when legal action could be taken, or you end up having to defend yourself on your actions based on what you've done in your documentation. So when we think about the theoretical background behind infusion therapy, we have to think about technology and clinical application. Of course, everything that we do as far as infusion itself is a clinical skill. And there's a lot of technologies that are involved with infusion therapy. We now have patients who go home with portable infusion pumps. We have patients that go home, and those pumps are oftentimes carried in little fanny packs that they wear around their waist. We have infusions that are infused via infusion balls, where the ball itself creates enough pressure to infuse the whatever the substance is that we're trying to infuse. We'll have to look at pharmacology. We have special considerations with neonates and pediatric clients, special considerations with antineoplastic agents and biological therapy. We are continually thinking about process improvement, performance improvement. We have to have a theoretical background in fluid and electrolytes, especially when we're administering IV hydration. We have to think about infection control, transfusion therapy, specifically related to blood and blood products, and then, of course, parenteral nutrition, where we provide nutrition, oftentimes total nutrition, to a patient via the intravenous route. So there's a lot of considerations that have to be made and a lot of knowledge base behind what infusion therapy entails. So when we think about an IV department, and not all areas have, or not all facilities have an IV department, but if they do, they are primarily concerned with infusion administration, IV access and monitoring. They also tend to be the ones that provide the patient and family education for whatever infusion therapy they're receiving. They are responsible for preparing the infusion, and then also for collaborating with other disciplines in the day-to-day care of these patients that are receiving infusion therapy. One thing I would mention, one department that typically does have an IV, not necessarily department, but has an IV therapy group, is surgery. Oftentimes, anesthesia will have specific individuals who are responsible for preparing the fluids that they're going to administer during the surgeries themselves. So sometimes they'll have a small component of what you might call an IV team that really kind of prepares those fluids, prepares the tubings, makes sure that the supplies are stocked, and those kind of things for surgery. So the standards that guide infusion therapy have been established by the Infusion Nurses Society, and this is just a picture of standards of practice, and you can take a look at that on an individual basis. But the Infusion Therapy Society have developed the scope of practice, the competencies, educational requirements. They talk about the care settings that infusion nurses can administer in. They talk about the client population and, of course, best practice. So this book of infusion nursing standards of practice really guides those that are certified in infusion therapy. So when we talk about the standards, some of the areas that we have to consider, we want to take a look at the practice setting because, of course, infusion therapy is going to be different in the hospital than it would be in the home setting. We kind of briefly covered neonate and pediatric clients a few minutes ago, but of course they have different intravenous or infusion requirements. Their doses are going to be a lot less. Their infusion times are going to be a lot slower. The equipment needed is going to be totally different for neonates and pediatrics. So there's a lot of special considerations in that area. Ethics, of course, the field of nursing is considered to be one of the most ethical and most noble fields. So no matter what area of nursing we're practicing in, we have to consider ethics. And of course, the scope of practice, quality improvement. How can we improve what we're doing? How can we reach the best outcomes for our patients? And how do we track and monitor that? Documentation, which we briefly discussed earlier. Infection control and safety. Anytime you're inserting an IV or administering an IV fluid, it should be a sterile procedure. So we have to take infection control into consideration and safety as well. Site care and maintenance, infusion-related complications, infusion-related procedures, and infusion therapies themselves. So what is the evidence-based practice behind infusion therapy? The nurse shall integrate evidence-based nursing knowledge with clinical expertise and the patient's preferences and values in the current context when providing infusion therapy. So to kind of sum things up, we as nurses, no matter what area or field of nursing that we work in, we all have roles and responsibilities within those fields. Infusion therapy is no different. Whether you're simply administering infusion as a staff nurse, maybe an antibiotic or a pain medication, or whether you're actually a certified infusion therapy nurse, we have to follow those same rules, regulations, standards, scopes of practice, and guidelines, as well as policies and procedures for the administration of intravenous fluid.